Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing just well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone US COVID statistic through today, September 12th. We invite you to submit any questions and comments you have down below or at any of our social media linked in the description. Starting with that COVID statistic, average COVID deaths per day in the last reported week were 33. The same week in 2024, we saw 155 daily COVID deaths. Your reactions to those numbers, Dr. Murphy, and the state of COVID here in the US?
Yeah, so we're at the end of the summer bump, and so we are seeing a very slight uptick in the number of deaths. But overall, compared to a year ago, it's markedly less. So we'll see how this pans out over the next few years, because the combination of people being vaccinated and people having infection, that all gives immunity, that all helps the population. So it looks good in the long term. You look at the wastewater surveillance projects, and they're down to the moderate range in most places. There's still a few high levels here and there, but the whole thing is coming down. But this is all going to come back in December or January.
Mhm. And it comes along with the announcement that COVID is no longer a top 10 cause of death in the US. Can you break it down?
Well, yeah, COVID got up there with cancer and heart disease in 20 and 21. It was the highest it was the third leading cause of death during the height of the pandemic. So, I mean, that was truly remarkable. Um, and it's been sliding ever since. It uh, fell to number 4 in 2022, and in 2023, it was number 10, and now it's number 15. So, fewer and fewer people dying from COVID, which is just tremendous, but it's all due to the immunity of the population. Notice it's not dropping off the list altogether.
Absolutely. And to keep up that trend, Pfizer just released the phase 3 trial data for this year's COVID vaccine formulation. Can you share the data with us?
Yeah, so Pfizer is one of the big manufacturers of the mRNA vaccine that they had, the first one that was out, and then Moderna followed. And Now this is measuring antibody levels, neutralizing antibody levels. That's what protects you. And they found that the data showed in these 100 adults that were tested a fourfold increase in neutralizing antibodies. So that's good. That means that the vaccine is working and the antibodies levels are higher, and that should protect more people. So that's how they get these vaccines out earlier before they can't do a study. If the thing is mutating so rapidly, and every year you look at the antibody level. That's the marker for success.
Mhm. And as far as who can get those vaccines, we'll talk about Florida a little bit later, but there are more states in the US that are bolstering their vaccine requirements. Can you tell us about those?
Well, yeah, the ACIP, the Advisory Committee for Immunologic Practices, that's the vaccine recommendation group. The experts that were on that panel were all fired, and they were replaced by a bunch of people that don't really believe in vaccines or are just outright anti-vaxxers. So they're not really interested in looking at the science. These are not real experts. So what's happened is many of the professional groups, like the Infectious Disease Society of America, the American Academy of Pediatrics, which is based here in the Chicago area, and other groups are making up their own guidelines, pretty much based on what was last year's. And they're using experts to come up with these guidelines. So the states that have done, I mean, it's almost every week there's another state or two that's done this. So California, Oregon, and Washington started this Western Alliance. Hawaii just joined them. New Jersey, Minnesota, and New York. They're talking about doing it here in Illinois. And this is very important because the states have a lot of power in terms of who's going to get a vaccine and who's not, and who's paying for it, and if it's insurance companies, you know, the states have power to basically force them if they want to, if the insurance companies are not going to do it, to give the vaccines out. And it ranges all over. The results are, the recommendations are not completely uniform. In New Jersey, this is just a Tuesday of this week. Anybody 6 months of age and older can get the new COVID vaccine. You know, so it's all over the place. But the one thing for sure is they're not following the United States guidelines. And this ACIP group is meeting on the 18th and 19th of this month, and we'll see what they have to say. The only trouble with that is Medicaid is linked in with the feds. So that could be a problem because half of the children in the United States have some form of support from Medicaid. They may not be on Medicaid, but Medicaid may be providing the vaccines. So that's going to be a little funny. We'll see if the state can get around that, you know, how hard they're going to really enforce this. But I mean, this is just really very unfortunate, what's happening here.
And we will keep our eyes out for any of those updates. And something you touched on there on this importance for children, even healthy ones. There's a new study showing that even the fewer cases of RSV, respiratory syncytial virus, can be very severe, even for healthy children. Can you break down the data?
Yeah, Swedish researchers just reported in the Lancet Regional Health Europe journal, which is part of the whole Lancet family of journals, very highly respected. You know, they looked over the last 20 years of all the people, everybody that got RSV, including the children. You know, they have these centralized databases. They know all the health care of everybody. And they found that 1.7% had RSV. So that was 1,400 cases per 100,000 persons. And it showed that 11.9 or 12% had very severe disease. You know, kids can die of this. They can clog up the ICUs and the hospital beds. They found that under these children, the underlying diseases that put people really at risk were only in about half of the children. So half of the children had no underlying disease. So this is why everyone has to kind of follow the same policy, because just because you don't have underlying childhood heart disease or lung disease doesn't mean you're not at risk for dying from a potentially preventable infection. So it was a really fascinating study, which from one of these big databases over 20 years. So it tells you really how severe these diseases are. And, you know, we have treatments. We have monoclonal antibody treatment to give to kids under a year of age, and if they have underlying diseases, 2 years of age. And then we also can vaccinate pregnant women with the RSV vaccine, because she will give the antibodies of the mother will protect the baby. So there's a couple ways to get around this particular problem, which can be lethal. So it's a fascinating study.
Very fascinating. And something else that's interesting here locally in Chicago, there have been more than expected cases of leptospirosis. Can you please tell us what leptospirosis is and what these cases could mean?
Yeah, it's a bacterial spirochete that is not too common in the US. There's 100 to 150 cases per year. In Chicago, there's usually two per year. All right. But this year we have six. So we tripled the number of cases. So even though these numbers are small, the increase is significant. So usually it starts out the symptoms are pretty mild, some aches and pains and fever, maybe a rash, vomiting, diarrhea, the usual kind of stuff. And sometimes it then goes away and then it comes back. And so that's called a relapse, a rebound. And 10% can go on to get very, very severe. And it recovery can take quite a long time, and there can even be death. So it's something you don't want to get. So how does it spread? It's spread by rodent urine. So Chicago has a lot of rats. They're rodents, and in these unfortunately in the Logan Square and Westtown neighborhoods, that's where these cases are kind of clustering. So what can you do? That doesn't mean you don't, you can't go out anywhere or whatever. It's mostly working like in gardens or something with plants, and it. You just have to, if you're doing that, you need to wash your hands a lot and just common sense type stuff. But it's just something to take note, and it's particularly in those neighborhoods right now.
Hmm. Definitely something to keep your eye out for, and always a good reminder to wash your hands, stay clean,
Um,
especially as we go into
in the
respiratory season
garden,
here.
working with any kind of dirt material, hiking in the woods, that kind of stuff.
Yeah. Now, the measles outbreak has continued here in the United States, spread all over the country. Can you tell us the latest data?
Well, remember, measles we didn't have any cases of measles in the year 2000, and now we're having a huge increase. There was an increase of 23 cases over the past week. 92% of them are in those who are unvaccinated or unknown vaccine status. And overall, 1,454 people have been diagnosed in this outbreak this year. But there's been multiple like little outbreaks of the year. 180 or 13% end up in the hospital. They get that sick. And three unvaccinated people died, two kids and one adult. So the number of outbreaks has more than doubled in the last year. We had 37 outbreaks this year compared to 16 last year. And then this year, in mid-August, there was another outbreak in Utah at a school cycling event held on August 16th. We don't know how many cases there are, but it's yet another one. But this is going to be the norm. If the vaccine rates for measles, which is highly, highly contagious, if the number of people vaccinated drops any further, and that's the direction it's going. So this may just become the normal. Thousands of people with measles, a few deaths, hundreds of hospitalizations. It's unfortunate because it's all totally preventable.
And talking about preventable, not just for yourself, but for those around you. Just yesterday evening, there was a announcement from the Los Angeles Department of Health regarding a very rare complication of measles in which an infant can, many years later in their life, die from measles complications. It's called subacute sclerosing panencephalitis. Is there anything you can tell us about it, Dr. Murphy?
This is a very unfortunate neurologic complication that often lethal, if not always. And this child who just died in California was not 1 year old, so it wasn't eligible to even take the measles vaccine. Measles vaccine's typically not given to 1 year because it's a live virus. All right, a live virus vaccine made from live viral particles. So there's always a little risk with that. So they don't give it to younger kids. Now, if the kid is traveling to a place where there's low vaccination rates, you can give it as early as 6 months. But this kid most likely picked it up from because there's so much measles floating around in the United States right now, got it, and then got this complication and died. So this person wasn't eligible to take the vaccine. But this is the whole problem in public health. If you don't treat the public, you're going to have these casualties like this. This was preventable. If we weren't having this huge outbreaks outbreaks all over the place in the United States in the last couple of years, because the vaccine acceptance rate has dropped, this wouldn't have happened.
Yeah, very,
Yeah,
very heartbreaking case.
very.
And looking at the opposite of prevention now to the state of Florida, there have been more reactions from experts like yourself on what we could see with this lack of vaccine mandates. Can you offer up any information?
They just changed the rules in Florida that you don't have to take any vaccine for anything. You can go to school, you can work, you can do anything. Mandates are now not they're I don't know if they're illegal, but there's no requirement to take any vaccine. So hepatitis B, which can cause chronic viral illness, cirrhosis, and death. Chickenpox vaccine, debilitating. Haemophilus influenza type B vaccine, which can, also cause death at the worst cases. Pneumococcal conjugate vaccines, all these vaccines, which typically have been given to all school kids, now they're not required. And so we'll see what happens. Up until now, the uptake of those childhood vaccines was about 89% in Florida. So we'll see what happens if the number one, if the rate goes down, and two, if the rate goes down, how many more children will die from these preventable diseases? So this is it's just very, very unfortunate. Even taking the flu, we had a huge flu season last year with 266 pediatric flu deaths last year. And then that's a high number of deaths just for flu. And for whooping cough, which is another one of these preventable diseases, there were 10 deaths last year, 10. So, this is going to become the norm if these vaccines aren't mandated, particularly for school-age kids. It's just really sad. We are really going backwards.
Absolutely devastating, and not just here in the US, but overseas as well. The cuts of US funding for lots of diseases, including tuberculosis, can and likely will have catastrophic effects. Can you break that down for us?
Well, TB is an old disease. It's been around forever. There were TB sanitariums in the old days, and then we got treatment. There's no real good vaccine. It's really prevention and treatment. And it's worldwide. And anybody can get it if you get exposed to somebody with tuberculosis. But what happens is in the very low income countries, they don't have the resources to effectively diagnose, treat, and monitor the patients. They just don't have it. You're talking low income countries is median per capita income $1,000 per person per year for a whole year. Okay, they don't have the resources to do this. So other countries and global agencies and stuff support TB efforts. The United States was a big supporter of this. They spent 5.7 billion in 2023 through USAID, which is now basically gone. I should say, of the 5.7 billion spent, USAID provided 406 of that 5.7 billion. So, I mean, just not even 10%. And it goes through the Global Fund. It's very linked in with HIV because if you have HIV, the TB is worse and it's harder to diagnose. There's a whole bunch of things. So Now, with our chunk removed, um, public health people have uh, predicted there will be somewhere between 100,000 and 2 million deaths in a 6-year period. It's a pretty wide range, but at least 100,000. The reason why there's such a wide range is, can they scramble and pick up and get other agencies to replace what the United States had been doing? Now, again, we've talked about this before. Um, you know, the way to do this, if you're going to pull out of something that's life saving, you do it over a period of time so you can find other donors and, you go, there's like an exit ramp. So what happened here when USAID was just cut like that, it was just like a cliff, just boom, and you just can't get the resources together fast enough. So it depends how fast all that can happen. So whether it's going to be 100,000 or 2 million deaths in 6 years, but it's just another preventable crisis.
Apologies for my audio issue there. Very sad, very disastrous situation. And we did receive a last minute question asking if the Novavax vaccine for COVID will be available in pharmacies this fall, and it will. It was approved, so I just wanted to throw that in there before we move along. But our final story for today is about cuts to food safety systems here in the US, those monitoring systems. Can you give us the specifics?
This is another thing the CDC used to be really great at. However, this has been cut now. So it's within the CDC, it's called the Food Net, Foodborne Disease Active Surveillance Network, Food Net. And this was started in 1995 following an E. coli, which is a bacteria, outbreak linked to contaminated meat at a restaurant called Jack in the Box, which is also, I think, faded away. Anyway, this outbreak sickened hundreds of kids, and 4 of them died. And so they started this agency within the agency to follow all these food outbreaks. And we talked about many of these food outbreaks on this show. And so they're cutting that. And it just is so short-sighted that they're limiting what they're able to track. So they're going to continue to track salmonella, which causes foodborne illness, and the E. coli strain. But they're cutting everything else, Campylobacter and Listeria, and Shigella, Vibrio, all these there's many other things that can cause a foodborne illness. So they just don't have the funds and the infrastructure to support that. Very, very short-sighted. So this is going to get a lot of people sick. And, occasionally people can die from food poisoning. So another example of what's going on in our public health world.
Absolutely, and something to be more aware of if we're getting less notification to keep your eye out for regarding food safety. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise breaking down all of the stories and the data for us. Data for us, it's much appreciated.
Well, thank you, Katie.
And thank you all for joining us for this week's episode of Ask Dr. Murphy. If you have any questions or comments, please leave them down below in the comments or at any of our social media linked in the description. We'll see you next week. Have a nice weekend.